By the time he hit about a year old, we realized that there was something seriously wrong with the left leg, not realizing there was anything wrong with the right leg.
His patellas were not sitting in place. The patella is the kneecap, and normally it should sit in the middle of the femur on the leg, and it was moving off to the inside of the leg, and that did not allow for him to support weight on his hind legs, and it also caused the bone in his left femur to grow crooked. The left leg was much worse than the right leg. The left leg was a grade 4 patellar luxation. The right leg was a grade 3 patellar luxation. So we decided to repair the one that was not as badly affected first to give him a good leg to stand on after the surgery on the left leg. The left leg is going to require what we call a corrective osteotomy because of the abnormal forces. The bone grew crooked. We were able to do a CT scan of his whole pelvis and 3D print the bone, and you can see that the bone has grown where it's sloping what we call medially, or having medial varus, because it did not grow straight from the pressure from the patellar luxation.
He sailed through. Everybody here is so compassionate and kind and patient with him. He's been, healed. They've always told me what to expect, told me how to handle it, and it all went as expected.
Well, it allows us to look at the bone in 3 dimensions and measure the angles and the slope of the bone, and it will also, these are made out of a plastic that we can cut, and it will allow us to practice the surgery ahead of time, so we can make sure that we have the right angle, take the right amount of bone out, and we have this special plate made that's going to go on the outside of the bone to hold it in its new position once it's repaired. And you can even see from this how much off that is. This part of the bone should be aligned with the plate, and that degree of angulation is going to be taken out so that when we repair it, this bone will sit and rest against the plate. It'll be held in its new position, allow him to have a nice straight leg to walk on, and should allow for us to get the kneecap back in place.
Now that he is probably about 90 days out after the surgery, he's putting his leg down. Not that I doubted it would happen, but seeing him hold it up for such a long time, it was hard to imagine how he would actually ever walk on 4 legs, but he is putting weight on it. He's almost like a normal little dog again. In fact, he comes to work with me every day, and now instead of having to carry him everywhere we go, I have to remember to put him down on the ground and let him walk like a normal dog, because he can. And everyone that sees him is actually impressed and amazed to see that he can actually walk, because for such a long time, just to get 10 feet across the room was exhausting to him, and I was concerned about his back and having long-term issues with his back or the other legs. And now he's like a normal little dog, so I'm really happy about it.
Being able to have this new technology allows us to do new innovative procedures. That is always exciting, bringing the latest, greatest medicine to our hospital, and it's also better patient care and better outcomes for the pets.